How does CF infection surveillance detect pathogens? Imagine a team working behind the scenes to keep people with cystic fibrosis safe from harmful infections. This team uses a combination of careful sample collection, advanced testing, and data analysis to spot dangerous germs early. The process begins with regularly collecting respiratory samples like sputum, throat swabs, or fluid from the lungs. These samples are sent to specialized labs where they are cultured. Culturing means growing bacteria or fungi from the samples to see what is present. This helps identify common cystic fibrosis pathogens such as Pseudomonas aeruginosa, Staphylococcus aureus including methicillin-resistant strains, Burkholderia cepacia complex, Pseudomonas maltophilia, Acromobacter xylosoxidans, and nontuberculous mycobacteria. Once the organisms grow, labs perform antimicrobial susceptibility testing. This step checks which antibiotics can effectively treat the infection and tracks resistance patterns over time. Knowing this helps doctors choose the best treatment options and prevents the spread of resistant bacteria. To understand if infections are spreading between patients or happening independently, molecular typing techniques are used. Methods like whole genome sequencing or PCR-based tests compare the genetic makeup of bacteria from different patients. If strains are very similar, it suggests transmission within the clinic or hospital. If they are different, the infections likely came from separate sources. Epidemiological monitoring plays a key role too. Infection control teams analyze data on how many new infections occur and how widespread existing ones are within the cystic fibrosis community. They look for trends over time, which can signal outbreaks or shifts in the types of bacteria present. This information is shared regularly with healthcare teams to improve prevention strategies. Infection surveillance is closely linked with infection control practices. For example, patients are educated on hand hygiene, respiratory equipment is disinfected thoroughly, and measures like patient segregation are used to prevent cross-infection. When difficult-to-identify organisms like Burkholderia cepacia complex are involved, samples may be sent to reference laboratories for further testing, ensuring accurate detection and understanding. All these efforts create a comprehensive system that detects pathogens early, monitors how they spread, and guides effective treatment. By combining routine cultures, genetic analysis, resistance testing, and epidemiological data, healthcare providers can better protect people with cystic fibrosis from serious infections. Remember, always consult healthcare professionals for personalized advice and treatment options.